got in. How does medicine work these days? The search for knowledge, its evaluation, and the way it's made publicly available. We have an unprecedented global urgency. The way the public puts pressure on the healthcare system through the media is enormous. So, like you know about the media pandemic and what is being said about the risk of off-label drug use and things like that. So, does all that change the way medicine works or will work in the future? What do you think?
Well, the situation is very special because we're on enormous time pressure right now. And those hospitals which have a lot of patients usually are under enormous medical stress. So they don't have the time to do actually good research. If you ask a doctor who just worked 14 hours trying to save lives to do some, don't know, 14 or 15 pages questionnaire for some scientific studies, it's just not doable. So you have the hospitals without patients, they have the time, the resources, and you have the hospitals which have a lot of patients, but they don't have the resources. Furthermore, those studies usually are not coordinated. There is a database where now all the studies are registered around COVID-19. It's a three-figure number right now, but we don't have the time to actually go through it, make informed decisions, what is actually a good study, which could help a lot, a study which should participate. The scientific community is not coordinated to actually gather data, process data in a fast way, in a informed way, and we're not ready actually to perform those analysis we should in a short period of time. And I'm pretty sure in the aftermath of this COVID-19 crisis, those doctors, scientific people, they will sit together and ask themselves, well, how can we speed up this process in a coordinated way, which is right now absolutely not possible, leading to the situation where a single hospital does a very small scale study and has some results and is actually published in some top peer-reviewed journal, which would never publish that in another situation. And now the scientific evidence, it's like a bowl of soup, you know, a lot of things are swimming in there, but you don't know what's the value, what's exactly in there. And a lot of rumors start. I've read in that journal that you should do this and that. And it's very special situation. We have to act and upon a very limited data, and it's hard because media are sharing those results too. Some patients are coming to us that they have read that this and that drug probably works or does not work, should be used or should not be used. And it's a very strange
And I
situation, a
think
lot
it's
of pressure.
natural because people, you know, they try to cling on whatever they can get, that's also
Absolutely.
human, you know, that you want to be hopeful and you're looking forward to something that may bring a change to this situation. So thank you so much, Dr. Nufer. There are many more aspects that we could discuss, but I want to at least take one or two of those questions that came in. And one is from Lauren, and she asked, being an asymptomatic carrier is scary. So do you see them offering antibody testing for the masses in the near future?
Yes, probably yes, in the coming weeks. We're talking to all those people offering lab results, lab tests and results. And actually, they're telling me for now 4 or 5 weeks that in the next 2 or 3 weeks we'll have valid testing, antibody testing. However, we're still waiting those 2 or 3 weeks. The problem is how good are those tests? There are, as you probably know, other coronaviruses, and we need to make sure that if you have a positive antibody testing, it's actually for COVID-19,
Yeah.
not for one of the other coronaviruses. because otherwise you would thinking that you were going through this COVID-19, and actually it's not true.
Yeah.
Furthermore, we need to know how long those antibodies are positive, meaning that if you had probably the virus a couple of weeks in the future, a couple of months ago, and you are negative, are you really negative or not? What is the immunity? Is the immunity if you are
Lots of
EPD
question.
positive? Are you still immune? So there are a lot of questions. The test alone doesn't help much. We need to know what's the meaning of a
Yeah.
positive test, and that's probably going to take, sorry, another
Yeah.
couple of
Yeah,
weeks.
that's the way it is. Claudia is asking when we are allowed to go back to work. Should we be wearing masks and gloves, and for how long?
Depends on what you work. I think it's a matter of debate. If you're taking the public transport system,
Hmm.
you're going into a bus which is full of other people, into a train, lots of people's in there. It is debatable to wear a mask. Remember that it's only helping you if you don't touch the mask, which is hard to do. Believe me,
Mm-hmm.
people don't trust me in that, but it's just a
Yeah,
fact.
we are creatures of
Um,
habits. Absolutely. Yeah.
Absolutely. Observe other people.
Mm.
If you're riding those buses or trains, how many times they're touching their mouth or nose. So if you manage not to touch it and don't touch any other surfaces, it might help. But otherwise, if you're working for on your own, and you're washing your hands frequently, um, that might be the best thing to do.
Okay.
Staying home is not an option for the economy.
Absolutely. And maybe as a last one, I really like this because it's getting, I guess many people are in a situation like this. Jimena asks, so, or she says, I have a friend who is diagnosed with corona disease, and she's about 35 years old. Her kids are, were also tested. However, they presented only the flu symptoms. Do you think it's safe for me to send my daughter back to the daycare, taking into consideration that I have to take the bus to get there and come back home? Very practical question.
Well, the first thing to consider here is that there are literally no kids in Italy and in Switzerland dying because of these viruses.
Mm-hmm.
Um, the young people, they have very limited symptoms. It's really just like a flu. Death report starts with 50 plus on a very limited number. And of course, the older you get and the more comorbidities you have,
Sure.
the more serious it
Mm.
gets. So if you're young, you have children, don't worry too much. I mean, really, don't worry too much.
Mm-hmm.
With daycare, if you let them know that your kids have been symptomatic in the past couple of days, probably they're not going to take them. Most daycares, I know from my employees here, they're really strict and they ask you, have your kids had any symptoms in the last 14 days? If yes, they don't take them. You have to wait. Of course, as I said before, riding a bus, a crowded bus especially, is more dangerous than driving in a car, your own car. It's just a matter of risk. But don't be too worried for your kids because most likely they have very limited symptoms and will go through it easily,
Mm.
easily. So
Okay.
don't panic too much. Don't be afraid too much. They will go through this without big symptoms.
Yeah, and it's great that grandparents can still communicate with grandchildren via, video call and all these kind of new technology that we have today that we hadn't when the Spanish flu was, the
Right,
problem of the
right.
day. So thank you
Finally,
so
our
much.
grandparents have to learn to use those things.
Yeah,
Yes.
that's true actually. Yeah. Um, Thank you so much, everybody, for watching. We will have our next session here tomorrow at 1 hour earlier than we had it today. Dr. Nufer, thank you so much for your time and all those insights. My last question to you before we finish, and that's more like a philosophical question. So what do you think? How will the world have changed when we emerge from this pandemic? How will the new normal look like? Do you think we go back to the, how the world had been before, or will something have changed?
I think that probably this social distancing thing psychologically will remain in some way, will be around a little bit. Say hugging each other for saying hello, shake hands. We
Mm-hmm.
probably won't do this the same way as before. I'm not saying
Mm-hmm.
that this is not going to be back, but trust in each other might be affected somewhat. So this social distancing might be around longer than we think, or than other things are around.
Okay. Okay.
Of course, economical things, practical things,
Mm-hmm.
acceptance of working at home,
Mm-hmm.
global economy, all those discussions will come up. But more on the psychological side, um, keep a little distance
Mm-hmm.
might be a good thing to consider, might be sticking around longer than we think.
Yeah, it could be interesting to see whether we will adopt new rituals to say hello to each other, things like that. Yeah, so I'm curious about it. Thank you so much, everybody. Thank you for watching. Please follow the guidelines of your local government. Take care and be safe. Thank you.
Extraordinary challenges require extraordinary responses from thought leaders, company executives, and employees. Help organizations crisis wisely and professionally. For over 20 years, we've been committed to providing relevant knowledge from reliable sources to help people make better decisions in their personal and professional lives. In line with our mission to empower decision makers with relevant knowledge from trusted sources, we are proud to offer businesses free access to our full library until May 18. Embark on a no-strings-attached knowledge journey with getAbstract. Sign up today.